Okay, one of the things that we have been kind of discussing, I mean me with many in the audience, is how we should react to the deaths of the unvaccinated, or more specifically, the anti-vaccine individuals. Anti-vaccine individuals who prominently say we're against the COVID vaccine, and then they die of COVID. I get emails all the time from people saying, David, you really shouldn't gloat about anti-vaxxers dying. And I agree. I don't gloat about anti-vaxxers dying. I've said time and again, I feel terribly about people who have been misled into thinking the vaccine is a bad thing, and then they get COVID, and then they die, and their family members grieve, and it's sad. I don't gloat about it. But this is super interesting. There's a column in the Los Angeles Times by Michael Hiltzik, which says we should be mocking anti-vaxxer deaths. And it is a fascinating read. We will link to it, and I encourage you to look at it. Michael writes, among all the ways that COVID affects our lives, the pandemic confronts us with a profound moral dilemma. How should we react to the deaths of the unvaccinated? On the one hand, a hallmark of civilized thought is the sense that every life is precious. On the other, those who have deliberately flouted, that's not flaunted, remember, that's a word, flouted, sober medical advice by refusing a vaccine known to reduce the risk of serious disease from the virus, including the risk to others, and end up in the hospital or the grave, can be viewed as receiving their just desserts. That's even more true of those who not only refused the vaccine for themselves, but publicly advocated that others do so. It has become common online and in social media for vaccine refusers and anti-vaccine advocates to become the target of ridicule after they come down with COVID, and especially if they die from it. Witness the subreddit Herman Cain Award. The site is named for the former Republican candidate for president who became one of the first political notables to succumb to the disease after publicly defying social distancing measures. Like another site, Sorry Anti-Vaxxer, the subreddit hosts snippets and photographs of anti-vaccine advocates, often taken at their deathbeds. The issue of how to think about the deaths of unvaccinated has been thrown into high relief locally by the case of Kelly Earnby. Remember, we covered that. That's the Orange County Republican who was against the mandates and died of COVID unvaccinated. Earnby's death promptly came to symbolize the rift in the social fabric caused by the ravages of COVID. And then it goes on to say that some of what is happening with her is bigotry and hate. Michael Hiltzik has a different take. He says, to begin with, let's stipulate not all unvaccinated people are alike. Some are unvaccinated for legit medical reasons. Children for whom the COVID vaccines haven't been ruled safe, or someone with a real medical reason. Some may have faced obstacles in getting to a vaccination site. Others may have refused the vaccine because they've been deceived by Fox News or whatever else. The deaths are truly lamentable. Finally, there are those who have voiced public opposition to the vaccines, not all of whom are unvaccinated themselves. Earnby was in that category. She asserted opposition not to vaccines, but to mandates. And Hiltzik goes on to say, it should be clear that opposing vaccine mandates as a substitute for opposing vaccination itself is a fundamentally incoherent position. It's little more than the garden variety small government Republican ideology. Hiltzik points out the significantly lower vaccination rate of Republicans and says mandates do work. Requirements that people provide evidence of vaccination have been associated with heightened vaccine rates. As for whether vaccination mandates are a slippery slope to more government control, which many of these people maintain, government mandates for vaccines have been with us for decades, and for other kinds, wearing seatbelts, having airbags in cars, banning smoking in public places, and that these mandates exist because the diseases threaten not only the infected people, but also the community. And Hiltzik goes on to say, ultimately, that it is so pernicious that we have these people around advocating against vaccines or against vaccine mandates, that in fact, we should be ridiculing them, that in fact, we should be mocking them, and that in the long run, even though it feels like a ghoulish thing to do, the same way that vaccine mandates work, mocking those who are anti-vax, outspokenly anti-vax or anti-mandate and then die, actually is effective at getting people vaccinated. That it might feel wrong, as I have said, and many of you have said, but that it is actually a necessary thing to do because of the public health consequences. Check out Michael Hiltzik's opinion piece, and I would love to hear from you about this. Let me know what you think. One of our sponsors is Athletic Greens, which makes comprehensive daily nutrition really simple. People are busy. We're not always getting effective, balanced nutrition from the food we eat. We sometimes are combining all sorts of different vitamins, supplements, different things that may be relevant to us. AG1 by Athletic Greens is a delicious drink that just simplifies the entire thing. It's one product. You get all of the things you need, 75 vitamins, minerals, and whole food sourced ingredients. It's a multivitamin, it's a multi-mineral, it's a probiotic, green food blend in one daily serving. Really easy, high quality, bioavailable ingredients can fill those nutritional gaps in your diet, and they can help with gut health and digestion and support you in other ways. And they can replace multiple products and pills that you might be taking. It's just one drink, really simple. I've been enjoying the AG1 drink by Athletic Greens. Tastes good, helps me get everything I'm trying to get. Athletic Greens is giving my audience a free 1-year supply of vitamin D and 5 free travel packs with your first purchase when you go to athleticgreens.com/Pacman. The link is in the podcast notes.